Hi, I'm Tracy Hickenbottom, and we are live from Hospital for Special Surgery, but actually in Hartford, Connecticut today, talking to one of our all-star patients who's going to share a little bit about his story and his recovery and how he got back in the game. Also, for those tuning in, just to let you know, if you have a question for Dylan today, please type it in and we'll try to get to that question during the time. But if not, please always leave those questions and we will be getting back to them at a later date. Additionally, for those who don't know a lot about HSS but is interested in hearing more about Dylan's story, you can do all of that by going to hss.edu/back in the game, and you can hear about his story as well as the other 1,800 patients who have submitted their stories as well. Dylan, thank you for joining us today.
Thanks for having me.
Can tell us a little bit about yourself?
Yeah, so my name is Dylan Udall. I'm a professional alpine snowboard racer. I qualified for the team when I was 15 years old. I started competitive. I was a competitive snowboarder at the age of 9, and I started snowboarding around 6 years old. And I've gone through 2 very successful surgeries with HSS, and yeah, they've been amazing.
So let's backtrack a little bit.
Yeah.
How did you get into snowboarding?
Yeah, it's actually a really funny story. My dad, well, I'll backtrack a little bit more with how my sisters got into it, because if it weren't for them, I probably wouldn't have gotten into it. My dad saw my sister Sam watching a TV show. It was a beautiful winter day, and he didn't want his kids just staying inside, so he brought my sister to a local mountain and got her a couple skiing lessons. And it kind of just snowballed from there. And then I was a skier before I was a snowboarder. And we then started going up to Vermont because the mountains were just a lot bigger. There was more opportunities there with different programs. And one night I was in my room and I told my parents they were ruining my life because I wanted to be a snowboarder so badly. So it just started from there, and it was just a huge snowball effect. And I just loved it so much. I was addicted to it. I still am addicted to it, and I've been doing it ever since.
So let's talk a little bit about how you injured yourself.
Yep.
Coincidentally, from what I understand, it wasn't even doing snowboarding.
No, it was not. I just got back from national championships in Colorado, and it was the second day of lacrosse practice. I do not know why I was on that field to begin with. I turned pro the year before. And I still loved, those team sports, soccer, lacrosse. I just loved being on a team with other guys. So I was still competing, and, various sports. I was also a golfer too. And I was backpedaling. My legs got stuck in the ground, and I just went the other way, and I just felt all this ripping in my knee, ACL and meniscus. Yeah, it was pretty terrible.
And what happened from there?
Yeah, so they almost immediately. I mean, I was screaming, and there was, at my high school there was so many fields, and all the training people were on the fields with all the golf carts. They rushed right over to me. They actually had to stop a baseball game in the middle of a game because they had to drive the golf cart across the field, and I went right into the trainer's room. And they did a couple tests on my knee, a couple locking tests, and just from the looks on their faces, I knew immediately that it was done. So yeah, it was bad. And my mom, they called my mom. She came over, and I had a towel over my head, and I was just clutching my knee, and it was bad. Yeah. And
I mean, I know that it was a terrible circumstance, but what was going through your mind at that time? Immediately,
I thought of snowboarding. You only hear about, I was 15 years old. I mean, what 15-year-old kids tear their ACL? I know there's some kids that are younger that do it, but it was rare. Even though ACL injuries are very common, but, for much older athletes, I mean, you see guys in the NFL tearing their ACL every single week. So that's what I thought about immediately. Like, will I be able to come back from this and get back on a snowboard? And be what I was before, and hopefully even better. That was going through my mind right away.
And where did you go immediately when you left the field?
Yeah, so we went. We went to the trainer's room. They put ice on my knee, and I got an MRI later that night at a local hospital. But actually, right from the field, I came home, and I remember getting out of the car and just breaking down. in the driveway with my mom, just because I was just overthinking everything of, will I be able to snowboard again, and just be a competitive athlete again, which is such a huge identity in my life. So yeah, it was, and then so later that night we went and got the MRI. It came back, positive that it was an ACL. So yeah.
And do you recall how your mom found the HSS and how you got there?
Yeah, so actually we've had past family members that have gone to HSS before. I mean, they're #1 orthopedic place in the country, so it was a no-brainer to come here. And we actually have a very close family friend who knew Dr. Alchek, who performed the surgery on me. And after looking him up and just seeing his accolades, it was a no-brainer to choose him and just do it and get it over with, and then start the rehab process.
And tell me a little bit about the surgery, because at that time, had you had any other surgeries?
No.
Okay, so this was your first.
Yeah,
and
this
it was
was
a major surgery.
First surgery, major surgery, and actually this might sound crazy, but I was actually not excited, but I thought, it was a very cool experience. I was 15 years old, and on the back of my head, I was, of course, thinking about snowboarding and not being able to, I might not be able to snowboard again, but it was, it was just mind-boggling.
So when you met Dr. Olchek and his team, do you remember your mom or you having any questions for him about the surgery and what that would mean for you post-op?
Yeah, just basic questions, the recovery process, what that would look like, the timetable as to when I could have the surgery, and that was actually a little bit of an issue because most people who have a surgery, they usually do it a week or two later. But in my situation, because I just got done with my snowboard season, I missed so many weeks of school that I couldn't have the surgery right away because I was actually being an athlete, but I'm also a student at the same time, so I couldn't just have the surgery right away and miss a week and a half, 2 weeks of school from that. So actually what we decided to do is we decided to rehab for about a month and a half of very intensive rehab before I went into surgery. They were basically taking my leg and pushing it as hard as they could to break up all of the scar tissue that was in my knee. So when Alchek and his team went in, it was super easy for them to just repair it. And that was definitely the hardest and most grueling pain, without a doubt, before the rehab before surgery. Yeah.
And then you had the surgery, and how did you do during that time?
Oh, it was amazing. I don't remember. You hear so many stories of patients and athletes being in so much pain after surgery. I don't think I was in pain once throughout the whole thing. Of course, I was weak. My leg, the muscles weren't working for a really long time, but not once was I in pain. It was just building that strength slowly but surely back up, getting back to where I was, and then getting stronger.
So that's important, and especially the getting stronger part. And now that you went through the surgery and now you're headed to recovery, how difficult was it as being an athlete and wanting to get to that end of the road very quickly? Was it hard for you to set the pace?
It was very hard. I mean, these recoveries, they're not 2 weeks, 3 weeks. They're not 2 days. They're, half a year recovery. Even with ACLs, you're not fully recovered 2 years. So for me, it was, the physical aspect of recovering was fun. That was the fun part. I accepted a physical challenge. It was fun doing it every single day of trying to get my legs stronger and seeing the progress. The hardest thing was the mental side of it. Was, this is a marathon. It's not a sprint. And you just every single day you just have to slowly chip away. And sometimes you took 3 steps forward and 1 step back. Sometimes you took 10 steps back. But you just need to trust the process and just slowly chip away at it.
And as you move through that process, did you find things that you did before a little bit more difficult? Was that discouraging, or did you find other ways to make sure that you stayed on track, but also, kept your spirits up?
Yeah, absolutely. No, the whole time, I had such an incredible support system around me. My parents, my trainers, my coaches. There was definitely slight discouragement. Sometimes do I still want to do this? But I just kept pushing through it. And, of course, when you're not using I wasn't using my left leg for a couple months, so it is so much weaker than it was before, and it was so much smaller than my right leg that, definitely some exercises were a lot difficult than others, but just every single day, just doing it over and over again, just, flexing the muscle. Like when I was watching TV, just, there was no time off from rehab. You can do something all the time. So like when I was watching TV or something, I'd be, flexing my muscle, like just doing anything I could to, speed it up.
And, while you were moving out of now the intense recovery time, and you started to do more things on your own, leading up to, like, I guess your first day back into snowboarding, what was that like for you? Did you find yourself a little bit tense and not trusting of the knee? Walk me through that.
Absolutely. What you thought. I remember like it was yesterday. It was I think it was the scariest moment. I just trained so hard for 6 months straight, five months straight. I think I was back on snow 5 months later from when I tore it. And actually I got shut down that whole season with competing. My coaches didn't want me to compete, but I was still training with my teammates. The first day on snow was, it was scary, but my knee held up. I felt great, and I think it was just that mental hurdle to get over it. Physically, I was better than I ever was, but that mental block in your head in my head was definitely a challenge. But the good thing for me, and I think it helped me mentally, is that I didn't tear my ACL on a snow. I did it when I was playing lacrosse. Okay. So, knowing that I didn't tear it on snow was definitely, mentally it helped me out, helped me get through it.
Right, because that is a big part of it. Because I guess when some athletes get injured during their sport, it does make it a little bit trickier, and the trust level is a little
100%.
A little difficult.
Yeah.
But how were you feeling like after you got that first run through, and then what did you do after when you hit that second one?
Amazing. I mean, I hugged my coach and I was like, I can do this. Like we got this. Let's just full steam ahead. I remember I think the first couple times I was on snow, I was wearing a brace on my left leg under my snow pants, and that was definitely a little restricting. Okay. But I threw that thing right off and said, I don't need this, and I just it felt great.
Felt great.
Yeah.
That's good.
Yeah.
And then what happened? When we switched gears a little bit, and you came back again with the shoulder.
With my shoulder.
So tell me a little bit about that.
Yeah. So a couple years later, I just qualified. At the time, I qualified for Junior World Championships. It was in Rogla, Slovenia, which was without a doubt the biggest event that I've ever qualified for. And we had about a 2-week training camp set up in preparation for the event, and the first day of training was going very well, and we were about to pull the course, and I told my coaches, no, I want one more. I wanted one more run to just get through. I wanted to keep practicing, and that last run, I was on a toe side turn, and the positioning of your body as a snowboarder, your arm was up like this, and I hit a rut. And I didn't fall, but the amount of force, and we were going pretty fast, and my arm shot up, and it fell right out of the socket, dislocated it, fractured shoulder socket, glenoid bone chip. Wow. And it was bad.
You did a lot to it.
A lot to it.
A lot of damage. And I know you know that HSS was here, but how did you quickly and your parents quickly move to help you?
Yeah, no, it was right away. I was on the snow. I went right into the local clinic at the mountain, and they were able to pop it back in for me. And they did a graft there, and they saw that there was a chip on it. But I didn't know what that meant. I thought I'd be fine. You hear so many people dislocating their shoulders, and they can just pop it back in and put them back in the game. But for me, that wasn't the case. And when I saw Allcheck, he said, "Yeah, we got to do surgery right away." And so actually, what was happening was the glenoid bone. We had to do it very quickly because the bone was kind of just floating there, and it would have the body was trying to take it. So like a couple days later, we did surgery right away. And it was a no-brainer once again to use Allcheck. He's the best at what he does with shoulders and knees. So it was, we knew who to go to.
Now, tell me a little bit about the differences in that surgery, the pain-wise. What was that recovery like?
Yeah, it was a different pain level. I think the ACL was worse. But the feeling of that shoulder, just your arm just dangling, it's not a good feeling. But the rehab process went very smoothly. I think, the mental aspect of, okay, now I'm going back on, once I was able to get back on snow, it was a little bit more of a hurdle just because I did injure at snowboarding. So that was tough. Definitely.
Right. And then when you went through that, what was the rehab like for that recovery?
Yeah, that was a full summer of rehab for the shoulder. I mean, that was another 5-6 month rehab, and it was intense. But the good thing was that I was able, it's very different. The knee and the shoulder. The knee, it's a lot harder to get around, whereas the shoulder was, much easier. But the rehab process was definitely tough. And just the whole mental side of just wanting to, keep going.
Keep going.
Yeah.
And did you find through that rehab process that you had to set the pace and understand that it had its own healing time, and you had to respect that?
Absolutely. And it was tough for me because I'm a big, I love football, so all I wanted to do was, I love throwing football, and I couldn't now because of my shoulder. But yeah, it was just another thing of this is not a sprint, it's a marathon, and you just got to take it day by day, and just trust the process for sure.
And when you were able to finally get back and start doing your thing again, what was that like? Since you did injure yourself this time snowboarding, was it different mentally for you?
It was. It was without a doubt different. I mean, I'm pretty strong mentally, but it definitely took a hit on me just knowing, I was scared. Going into a turn, would my shoulder hold up? Because, you don't know, based on the snow conditions, something could happen in the blink of an eye like that. So, but, I just had to trust the fact that I did my rehab really well and that, nothing was going to happen.
How important, now that you've had the experience of HSS and was able to get to the right care, how important is that, in those initial steps for you as an athlete especially? How important was it getting to the right care immediately?
It's very important. Being an athlete, your body is your machine, so you can't take chances of, going somewhere that, you don't think that they can do, the right job. And at HSS, you don't even think about that. It was almost, instantaneous with Dr. Alchek. He was so confident, and he's such a professional, and just the athletes that he's worked on in the past, it wasn't, that didn't even come across my head of, let's just do this, let's get the surgery done with and just start the rehab process.
So now that you are healed, no issues that we know of, right?
Yeah.
What's up next for you? Like, what are you working toward right now?
Yeah, so I've had a full summer of no injuries. I've been able to train almost every single day, which was the first summer I've been able to do that for a while. So I'm feeling really good. I was able to actually get on snow a couple times this summer out west in Mount Hood. But yeah, my season starts in about a week and a half. I'll head out to Colorado for my first training camp. And then in December is when my first event is.
And walk me through a little bit about what your training regimen is like.
Yeah, so it's every single day, dry land training, Olympic lifting, just getting the legs. As a snowboarder, the most important thing is your legs, your core. So that's, we're hitting those muscles every single day, and just repetitions of when you get on the snow of actually. We're lapping, just nonstop lapping in our course. Just the motions of being in a course and getting ready for an event.
And then you said you had your first, run starting in December. Am I correct?
Yeah, my first event in Colorado.
And what are you hoping to achieve at that first run?
Yeah, so for me, it's I don't look at I need to win every. For me, it's just you gotta trust the process of I've trained as hard as I can. So every event, I don't look into it thinking I need to win this event. I'm just gonna race the best that I can. And the results will come. So that's with everything that I do, for sure.
And what advice would you give to other young athletes who are facing injuries or may potentially have injuries? What would you say to them?
Yeah, just to absolutely just hang in there. It's more they're going to find that it's it's a mental it's a mental thing than it is a physical thing. You know, being young athletes, you should enjoy the physical process of rehab. I mean, at least I did. That's kind of crazy, but I enjoyed, going to the gym every single day and, constantly working on what I had to work on to get better. But I think the mental side of it is the toughest part. And just knowing that there's so many people in your corner, your coaches, your parents, that are right there for you to, pick you back up if, sometimes you can't get through, certain day or something like that.
And when you start, training for your seasons, do you still, how well are you working with your immediate, trainers and coaches to make sure that you stay on track and that you stay healthy for the entire season?
Yeah, no, it's nonstop. I mean, one of my coaches actually, she lives close to me with the university that I go to, and so we're training every single day. We're hitting muscles, the small muscles around the knee. I'm not rehabbing specifically right now for my knee, but I'm doing, very similar exercises to what I was doing when I was rehabbing. The same thing with the shoulder, just, warming up, I think is a really important aspect to make sure that, your muscles are ready to go for when you go into an intense session, training session, yeah.
And do they have to sometimes, I was saying before about you pacing yourself?
Oh, yeah.
Even though you haven't been training as hard, hopefully enjoying your past summer, is it hard for you to get back into that regiment? Or you sometimes can just work your way right into it?
Yeah, no, you just kind of work your way right into it. I mean, for me, I love the process. You can't just get on a snowboard and go. You need to put time into the gym and training and, eating correctly and all that stuff. It all plays a factor into, doing well on a snowboard. So it's really year round. Just, making sure that you're ready to go for when the season comes in the winter.
And how different is it training for, you're training at Olympic level, that's, I guess that is your goal.
Yeah, that is the goal.
So tell me, what are the differences? Are there vast changes in how you train, or, do you just stick to the same schedule?
I mean, I don't think there's, vast differences. I think just it's the consistency of doing it, 5 days a week, 6 days a week, very consistent. In that aspect, I mean, it's very similar movements, I would say, making sure that, with snowboarding, it's very quick. So, we're doing, very quick, aerobic type movements, but it's, it's not, something that's crazy different from, what most people would do. I think the biggest difference is just pure consistency of, not missing days and just doing it, on a very consistent basis, for sure.
It's good.
Yeah.
And, also, can we backtrack just a little bit?
Yeah.
I want to talk about when you were talking about your ACL injury and, getting to the right care and working with Dr. Olchek and his team. Can you tell a little bit about the interactions you had with your physician and how that also plays a role in how you recover?
100%. I mean, I was lucky enough to have my parents, both my mom and dad, right by my side throughout the whole process. So they were really dealing with Keith, his Olchek's physician, almost, every other, I don't know how many times my mom called Keith. I felt bad for Keith because she was calling him all the time. But the interaction was amazing. I remember the first time I met Dr. Olchek, he was so confident. He came right into the room. He knew exactly what was going on, and he kind of led the way. And having, a doctor like that, just lead the way, was just, we were just going to follow him. And he knew exactly what had to be done. And, as me, as the athlete, that's exactly what I'm looking for. We don't need to think about all the other, all that other stuff. We just got to get the surgery and then start the rehab and attack it and then get back to playing our sport.
That's it.
Yeah.
And looking at snowboarding in general, I mean, it's not a sport that everyone can just pick up and start doing. Yeah. But I know you talked a little bit about your love for the sport.
Yeah.
And how different do you see yourself now in terms of what you've learned and about your body, but also how you I don't know what you call it, how you downhill snowboard?
Yeah.
What have you learned about your body in that?
Absolutely. I remember when I was younger. I started officially competing when I was 9 years old, and natural talent only takes you so far. It's the people who put all the extra time in, training, every single day, eating the right foods, doing all that stuff, that are, able to take it to the next level. And that's slowly what I'm learning now. I'm still young, but it's something that, you know, I've been fortunate to be around, you know, amazing trainers and people have, you know, been able to like lead me in that direction of, okay, if you want to get to the next level, this is exactly what you need to do. You know, you can't slack off in any, you know, in any area. So I think that's the biggest thing that I've learned, that, you know, you can't just hop on a snowboard and go. There's so many things that you need to do when you're not on the snow in order to, you know,
to get there, right?
Yeah.
And how important is family support through all of this?
Very important. I don't think I could be here right now without my mom and my dad and my grandparents, my friends, cousins, everyone. I mean, I've had to go through pretty, you know, serious injuries twice, and, you know, they've all been there right by my side. You know, my grandmother coming to my house, you know, I was pretty much sleeping on that couch in the living room over there because it's hard to get downstairs. And, you know, bringing over soup as just like a simple thing,
right.
Just, you know, brought my spirits up so much. And I think that, you know, family support is incredibly important. I've been, you know, really lucky to have an incredible family around me.
It's good. And in looking at sports in general, I mean, some people feel that sometimes after they have an injury, let alone two, sometimes it's hard for them to connect back with the sport, but you don't seem like you've had any of those issues and
not at all.
Still just want to go and go hard.
Yeah, no, I mean, sports, you know, injuries are part of the game. Sports wouldn't be what they are if injuries, you know, weren't there. It's something that, you know, as athletes in any sport, whether it's football, soccer, lacrosse, baseball, snowboarding, anything, it's, you know, it's what it is. So, you know, there are hurdles along the way, and you just got to, you know, jump over them and accept the fact that you're injured, because, you know, I'm not the only one who's been injured. There's so many other guys that also get injured. So it's just part of it, and you gotta, you know, just do the rehab and just get back on that horse.
Right. Yeah. And when you look across sports in general, there, like you said, there's a lot of injuries that are involved across the board.
Yep.
And some athletes have gone through some tough injuries. And I know you said that mentally, that can be the part that really either pushes you over and gets you back on track. And I just wanted you to just talk a little bit more about the mental toughness that you need, but also the fact that times you have to be able to say, whoa, I need to slow down.
Absolutely. I mean, like I said before, I'm a very anxious person, and, you know, right when I tore my ACL, the first thing that I thought about was, okay, I need to get back on snow right now. But that's not the mentality that you have to have. And there were so many times where I was rehabbing when I was in the gym that, you know, my trainers had to say, all right, we got to back down here. We got to, you know, either, you know, decrease the weight and stuff, because, you know, this is a process over 6 months, not a couple weeks. And so, yeah, that's just what you need to think about doing it, for sure. And, you know, for me, actually, you know, I think when I tore my ACL the year before, Adrian Peterson, a running back for the Minnesota Vikings, he tore his ACL, and he actually, you know, ran for over 2,000 yards the year coming back. So just seeing a guy like that, you know, obviously a much different athlete in regards to the sport, but just seeing someone like that come back so much better was a huge boost for me. Just, you know, I can do this. Absolutely, I can do this.
Well, you are definitely doing it.
Yeah.
And I wish you so much during this upcoming season.
Thank
and I hope you do very well.
Yeah, it was nice meeting you.
Thank you. So we've been here today again talking with Dylan from West Hartford. And to read more about Dylan's story and to hear more about his recovery, go to hss.edu/backinthegame.